And I'm hopeful that, we can develop really good, useful therapeutics using this allosteric approach that avoid, some of those negative side effects that we associate with cannabis.
You're going to want to swish and swallow, because the more contact you make with the inside of the mouth, the more that's also going to stay there, be absorbed, etc.
For it to be being pushed into the forefront now of the medicinal purposes of it was something that we've always known. And for us to not have an opportunity to capitalize on that economically would be foolish.
It's Reefer Madness, the podcast, with Trevor and Kirk.
Kirk, we're back.
Hey, Trevor, how's it going?
Good. How are you? Anything new and exciting in your world?
Geez, yeah, busy. Just really staying busy with little projects and trying to work on the podcast, work on the webpage. Interviewing guests like Owen Smith. We're going to talk to Owen Smith here right away. And you? What are you up to?
Just finished working the weekend, so nothing too exciting.
Okay, nothing too exciting. All right. Well, this is something new we should let our listeners know. We actually haven't met Owen yet. We usually do our wraps after one of us picks an interview. We're going to do something a little different and bring Owen into this conversation while you and I sort of talk to him. So we haven't done this very often, so this is new for us. Again, it's going to be a video podcast as well as an audio podcast. So you may remember, Trevor, that we've talked about Owen or around Owen several times. He's very closely knitted with the Victoria Cannabis Buyers Club, and we've done.
And just because I was confused and sort of with the last name, it comes up. So Owen Smith just happens to share a last name with Ted Smith.
Correct.
No relation.
Correct. No relation. Yeah, they get that a lot.
And from what I'm remembering, he was our baker. He was, making cannabis cookies for people with medical conditions, and then eventually ended up in some lawsuits about whether or not that was a legal thing to do. Am I getting of some of the basics of the story right?
That's Owen. We called him in episode 98 and episode 97. We did 2 episodes on him. We called him the godfather of Cannabis 2.0. In our podcast. So we're going to update ourselves on what he's been doing. He's put out a book that follows and chronicles his legal track with the federal government and Supreme Court. He's also right now on LinkedIn very, very strongly advocating for buying Canadian, elbows up cannabis.
Just because we should mention, I'm sure he will too. What's the name of Owen's book?
Yeah, so basically the name of his book is Legalizing Cannabis Extracts. This is a deeply moving story. Find out why cannabis was legalized in Canada and why it must be legalized around the world. Owen and Ted and the crew from the Victoria Cannabis Buyers Club, embarked on a David versus Goliath showdown with Health Canada and the Harper Conservative government. Basically, it's a book on the case that broke the cannabis laws. The Victoria Cannabis Buyers Club basically changed the laws in Canada. And we've talked about this, essentially how medical cannabis was determined by our courts, not by our health system. And that medical cannabis is a national program, whereas provincial health care is a provincial program. So that's the disconnect that we have in Canada with cannabis being medicine. Owen was one of the prime guys that got that rolling, and that's why I have fun with calling him the godfather of Cannabis 2.0.
And so beside the book, and like you said in our previous, and I'm sure we'll get more into the story through the Supreme Court with Owen, but besides his books or chronicling his trip through the Supreme Court, and I'm sure other things that he can detail, what about what's he doing about promoting Canadian cannabis?
Well, what he's done is he's created a website and a movement, I guess, and it's called the Elbows Up list. It's found at 420elbowup.ca, and basically it's a list of Canadian-owned cannabis companies, and it's an independent, non-verified list of Canadian cannabis industry. So I got us in there as a cannabis industry, as media. We are one of the few Manitoba people that have registered with his company. Yeah, so if people want to go up to his website, Albo's Up, 420albosup.ca. So we're going to bring him in here soon enough and talk to him about his two endeavors and catch up on them.
No, that's really cool. Like, people by this point, I assume, are probably familiar with the Facebook pages and websites that people can go to if, you're at the grocery store and you want to know, what type of tomato paste to buy, because you want to find the Canadian chips versus the American chips. So that's I honestly, maybe lack of imagination on my part, but I hadn't thought of needing to do that or there being a reason to do that in cannabis. But no, that's cool that he's sort of spearheading try to buy Canadian in the cannabis world.
So, Mr. Owen Smith, we've had you as a guest a couple times. This is just me touching base. You're a busy man.
So busy. I can tell you that. Late into the night last night and first thing in the morning today, I'm peeling through the edits that I've been provided on my book to put out that final copy as soon as possible.
Cool, man. Very cool. And I was on your webpage. Tell us about your book.
This book, Legalizing Cannabis Extracts. This is the pre-release copy.
How thick is it? Show me how thick it is. Okay, man.
It's about 500 pages.
Damn, you've been busy.
It's heavily referenced as a part of it. It is a tradition in some of the cannabis publishing over the years, started by Jack Herer, of trying to include as much of the real world reporting on the cannabis movement, so that you paint a picture based on that instead of the more higher level prohibition narratives. So you can sort of put your own story together. And that's what I've tried to do here. Jack, in the back of his books, would put newspaper articles, so you'd have multiple pages of those. I've created a digital resource. So on the front, you can scan the QR code and then go to the timeline. And the timeline covers the court case from the arrest all the way through the Supreme Court of Canada. All of the video that was made by news outlets, all of the news articles by major newspapers, and also what we wrote and what we put out about the case as we went through that six and a half year process. So.
Yeah, so Jack Herer, that's The Emperor Wears New Clothes, right? No Clothes, that book you talk about?
Yeah.
Yeah. Well, the timeline, when did this all start?
This started for me, the arrest was 2009, but this goes back years before this.
Okay.
With Ted Smith and Ted Smith's work in Victoria, and starting one of the first compassion clubs in Canada. And continuing to do that to this day. And I work with Ted 5 days a week at the Victoria Cannabis Buyers Club. And we are still, despite having gone through many legal battles and court victories, we are still under the pressure of the law. And we have multiple cases ongoing.
Update us on the Victoria Buyers Club. Last time I was there, the next day, I think it was the public health inspection was coming. Obviously, you guys passed that?
We've been moving through the city licensing process.
Right.
Has involved many visits and a lot of document preparation. I helped a little bit. I do graphic design as well. So I helped a little bit making some architectural plans, and we have submitted our application for rezoning, and we're just getting ready to pay for our cannabis business license to the city of Victoria, which city loves us, and they've known us for 30 years. So it started in the mid-90s, but the province doesn't love us so much.
Okay, so explain that. So Ted, I mean, people have to go back to our last episodes because we talk about it. But so you've got the jurisdictional provincial regulations, you've got the capital region stuff, and you've got the city of Victoria stuff. So are you guys, the city of Victoria recognizes you as a rec shop now, or what, as a cannabis store? Like what recognition is the city giving you?
They've given us a business license to operate as like a glass and pipe shop, essentially turning a blind eye to what we're doing, but at the same time recognizing us as a cannabis business and putting us through the licensing process so that we can get everything ready for the time when we win in court with the province or federally. We have a favorable ruling so that there wouldn't be any delay in getting us incorporated into the system. We strongly believe that we should be part of the legal system, and everything that we've done should help to prove that. But we continue to come up against opposition and the federal restrictions on edibles limits and the lack of places for people to go and talk about medical cannabis, have a community around them, and also a place to be. We have a community nonprofit.
So your book takes us back to 1998, like back when the first Supreme Court cases were heard.
What brings you back to where I began, which was coming to Canada as an immigrant.
Okay.
And in the mid-90s. And just at that very time that I was being planted out here, the first compassion clubs were too. That was like the BC Compassion Society, and then TED and the VIX in Victoria, the pioneers. So it covers some of this. I like to do a bit of a recap of the social history of cannabis legalization so that people can almost like feel like they've experienced it. Like I give insights into some of the hidden working, so things that people just wouldn't get from any news articles, things that I got from being on the floor, I'll be boots on the ground, delivering our newspaper, for instance, Cannabis Digest. We used to go to all of the cannabis shops around the lower mainland and Vancouver Island delivering, and we developed relationships with all of these businesses, some of them advertising. I'm not sure if this podcast was in the Cannabis Digest.
I don't think so. I mean, you're talking about, we started our podcast in 2017. So
Okay.
you're talking about before legalization of rec cannabis. And according to Canada, everyone seems to forget that medicinal cannabis was legalized, what, 2001?
Yeah, right. The story of cannabis legalization in Canada has been one of patients and community groups taking the issue to court for medical necessity, largely people with seizures, people looking after other people with serious illnesses, getting favorable court rulings, and the government having to respond, being forced to create the program, being forced to adjust and amend the program to make it more accessible in all the different ways. And if you're looking at that history, it's very clear that historically here in Canada, we've been dealing with opposition to legalization, opposition to cannabis in general. And
Well, I think the biggest problem in Canada is that the federal government was told by the courts that cannabis is medicine. And unfortunately, in Canada, provinces manage the medical side of things. So when the federal government said, "Oh, you have medicine," the provinces just said, "Yeah, well, we don't need to pay attention to that. That's a federal program." So the provincial programs just ignored it. I mean, I often get on my pedestal and say the provinces picked up on the fact that cannabis was an issue in 2017 when Trudeau was threatening to make it legal. But, cannabis is seen as a substance of misuse, not as a medicine. And that's the disconnect, I think, between the medical and the rec side. And now, didn't I read someplace that the federal government is maybe suggesting that people get their medical cannabis from rec stores now? Isn't that someplace I read in small print somewhere?
I was hearing the sort of suggestion put out there, do we really need medical would we prefer to have just the recreational shops?
Yeah.
And from my perspective, in the context that we're talking about, like developing and popularizing the idea of having cannabis available, it is through a medicinal framework that we've always been doing that. I see it as somebody who works in the media, who's had a newspaper and working for a long time in this area. These are the stories people want to hear. You just don't make popular stories having large companies asking for tax relief. That's something which we get alongside stories of large companies laying off thousands of Canadian workers. That sort of thing, from my perspective, is killing the momentum of the cannabis movement. What we created through working with individuals and elevating their experience helps to really illustrate the qualities that cannabis can offer society. And I think that's where the focus is best. It's best left. And if the government would prefer that we did not talk about medical and they would prefer that we just had a recreational scheme, to me, it seems like it's a control, right? A matter of controlling the story, controlling the frame, and keeping cannabis from growing any more than it already has, which we know that it has to, because it is an important plant. It has a lot of good qualities that help people in serious need. It really has to become more available. And I look at the global framing of this as well, the global stories with Thailand deciding, after seeing what happens with unfettered legal growth for recreational cannabis, they decided to go back to a medical framework, do something that's a bit more healthy for their country. Also, Germany, having recently said, we would like to review this in a medical community oriented social club model. Those perspectives, the focus is much more similar to what we're doing at the Victoria Cannabis Buyers Club than what the government has been doing with their regulations. I could go on about this because the federal system in Canada was brought in by the Conservative government before Trudeau, back in the MMPR, and they were very explicit in what they were doing, in bringing in a few large companies and then delaying to create a bottleneck that these companies then would dominate the market, and that would be easier to control, easier to manage than having tons of these little companies, Middlesex, all over. And those companies have all spent tons of money. For the most part now, they are become foreign owned. One example here on Vancouver Island is Tilray, which started in Nanaimo with Privateer Holdings, and then was sold off to Afria. Afria is headquartered in New York, and so the ownership and control of the companies is now not even Canadian. So it raises certain concerns as to what sort of pressure or what sort of political perspectives do the owners of those companies have here in Canada. Would it be better if, the owners and the perspectives and of the companies were Canadian, and that perhaps would lead to a more localized consideration? I mean, it's not.
I think that segues nicely, and Kirk and I couldn't agree more. And as a pharmacist, when I see a 70-year-old come into the pharmacy, they do not want, nothing against the bud tenders, but they have no interest in going to a local 22-year-old bud tender and ask about, what cannabis would be the best for their arthritis. So yes, a more medical system is absolutely necessary. But what you're talking about with Tilray, I think, segues nicely into one of your other projects, which was 420 Elbows Up.
I got the shirt on.
It's
right?
not for sale.
Yeah, it's beaver on it too.
Nice.
Canada's not for sale, but our cannabis is. So we have achieved legalization here in Canada, and that's a social accomplishment. And we've been able to sell this cannabis, and so we should control the development of our movement.
Tell us more about the 420 Elbows Up website and the people what were you trying to do? You know, is it kind of like when people go to a Facebook page and look up, you know, what type of pasta should I buy that's made in Canada? Is that the kind of idea, or what were we trying to do with that?
Thanks, Trevor. The 420elbowsup.ca is now live, and I'm currently in sort of a sign-up phase. So getting companies in Canada to volunteer information about their ownership structures, where they're headquartered, how much is Canadian owned, trying to get that volunteered from them. And then consumers can go to the site currently, but I'll reorient it once I have enough people, make it a bit more user-friendly. But consumers will be able to go and search by product type or province, and presumably then be able to find the brands that have signed up that indicate they're Canadian-owned. And then they can make a choice of their own whether or not they want to go with a company who's 100% Canadian-owned, or if they'd be happy with a company which is 50% Canadian-owned, but manufactures products in Canada. So kind of like what you see at the grocery store or the liquor store right now, with the little tags, give people an opportunity to make a choice if the money that they're putting down is going to stay in Canada, or how much of it is going to stay.
To clarify what you're talking about, companies like cannabis doesn't cross international borders, but paraphernalia crosses borders. So I imagine pipes for recreational people and grow lights for growers. That's all going to affect. So do you know? Can you speak to that? Are there many Canadian companies that are involved with the paraphernalia side of the cannabis industry?
Well, my concern was more about like the governance part and like the massive paychecks being paid out at the top levels, and how that differs from the amount of money the companies have been losing. But considering that, but there's also the supply chain stuff. What parts of what you need to grow cannabis or maintain your cannabis processor or equipment, all this sort of stuff. There was an article came out yesterday that mentioned a company. I put it up on LinkedIn. It mentioned a company that has already seen a great benefit, a Canadian company that's getting contacted now by companies across the country who are looking to avoid the tariff costs and work within Canada for their supply chain. So what's the company called? Green Tank. So
okay, we'll make a link. We'll make sure there's a link on our webpage with that.
Yeah, it says that Canadian brands are coming to them now because of patriotism, and they get a great service from their fellow Canadian.
So I've noticed that you do have T-shirts for sale on that page. It's a self-regulated. So I mean, we as Reefer Madness, we enrolled in it to let people know we are a small Canadian company that's trying to. I guess we're right now we're the only media people on your page. I can see, and you can sort on your page by region, by company name, and by. Yeah, you got filters. It's cool. How many companies are listed there now?
I think there's about 30, but I recently talked to BC Craft Farmers Co-op, who represent a large number of BC companies, and we're collaborating on an event for 420 coming up in Victoria. And so I'm going to work with them to sign up a bunch more BC small craft farmers. And hopefully that will start to get the ball rolling. People see this as a real opportunity to differentiate themselves from others and align themselves with the Elbows Up movement. Here's another one that I got.
Yeah.
So these stickers can go onto we put them wherever. Scan them with your phone and you're brought to the site. So it's a quick and easy way to access that list. and I've talked to a few retailers in Victoria who are just like, wow, that sounds great. We'd love. Yeah, as far as retailers reacting to the tariffs and this, I've only heard of a couple who have built their own in-house system for this, where they have done that work themselves. I imagine lots of them don't have the resources to do that. And so this could be a way to help them with that. And I do see it as a way to boost the smaller and medium producers who are really locally owned and operating, but struggling to compete with the mega giant companies that can outcost them on things.
Yeah, the cannabis industry is jurisdictional. So, I mean, Saskatchewan, I think Saskatchewan is one of the few places where a rec shop can actually buy directly from growers. Most other jurisdictions, they have to go through a government clearinghouse, don't they? So it's very difficult to have a, what am I looking for? A farm gate. It's very difficult.
In BC, we have farm gate program, but the government maintained their 15% markup.
They got to get their money.
Even when they had said, we will let you do it all yourself, you still pay us that 15%. You still have to warehouse, transport, admin, all of that stuff, but that's on you.
Well, but that's probably similar to the craft brewing or the craft liquor stuff in BC, because I'm sure the government still. Well, this is decades ago, but back in the day when I was looking at opening up a craft brewery, they were taxing the intake. They were taxing the output. I think there's 3 layers of taxes at one point. This was in Alberta. I don't know about other jurisdictions, but I imagine with the craft cannabis, they got to do the same thing, right? I mean, you're going to grow it on your farm. We got to tax it before it hits the stall. So
we know the taxes are high.
Yeah.
But my understanding is that this particular additional 15% is not something other industries deal with.
Okay.
It seems as though it's set up for a fight. Like if you want to reduce taxes, if you want any little going to change any part of the rules, even small ones, you're going to have to fight for it.
Yeah. Well, that's what's happened in the cannabis industry. It was the people that told the government to knock it off and let us access our medicine, right?
That's right. Yeah. And I feel that we have that leverage with politicians in their communities that could be utilized. But, the federal regulation that restricts testimonials, for instance, is something which I don't fully understand why it is, why we are not allowed people to share their own personal stories about cannabis.
Yeah.
Why can't you speak from your own perspective if you qualify it as thus? Everybody does experience cannabis differently, and that's an important point to share around. Having less education, less availability for people to learn, leaving people up to the internet to find out is not really very humane. I feel like having people to speak with, like a pharmacist or somebody who is very educated in medicine, is invaluable. At this point, it is invaluable.
And Owen, in case people missed it, I think you made an important point there about testimonials. So just in case people are unfamiliar, if I walked into a cannabis shop or a Victoria Cannabis Buyers Club, that means that if I say, I'm looking for something to help I'll pick a disease. I'm looking for something to help my Crohn's disease. And the person selling it, the person behind the counter, the person there, are they not allowed to say, I used this strain and it helped my Crohn's disease? Is that sort of how it's legally supposed to happen now?
My understanding is that is correct. They're only allowed to indicate the price and the availability of the product. They're not to speak about it otherwise. Although speaking to bud tenders in Victoria, they do it. because how can you not? Half the people come in, I just want to know which one helped me sleep, you know?
Well, that's the experience we've had. I do road stories every summer when I go and take the van out for a road trip. I go into rec stops shops and find out what the new issue is of the moment, and a lot of it has been, you've got a product that's called Sleep Ease, CBNs and CBDs, and someone walks in and says, "I want something for sleep." Well, hey. It says Sleep Ease, and I've given it to other customers who have benefited from it. So bud tenders, what I'm hearing from them is that they're allowed to speak from their own experiences, but not medicinally.
Yeah, regarding that particular piece of the law, it would be something to look up and verify, because you don't want to get a fine from an inspector, secret shopper, or something, and you don't want to give people any bad advice. That's for sure.
Have you guys got a nurse practitioner at the Buyers Club now? Have you got a prescriber there yet working with you?
No, we work with external prescribers only. Yeah, nobody there has that qualification. Well, we all, and the members especially, have a lot of experience, like 10, 15, 20 years of experience. So most of them even longer than that. And so there's a lot that they can share in and around how to safely consume cannabis.
Owen,
medical.
As a nurse, I get very frustrated because I've said this often. The federal government manages the medical program, the provinces manage doctors, nurses, and the colleges of those professions, and there's that disconnect. What I have found is happening is that the provincial governments prepared for cannabis as a substance of misuse opposed to medicine. And they keep saying, we've learned from our experiences with alcohol. We've learned from our experience with selling cigarettes. All that learning we're going to apply to cannabis. And again, the disconnect is cannabis is not liquor. Cannabis is not smoking. It's something different. And no matter how much research that suggests that, the Pavilion tax. What is it, Trevor? You can help me with the
Pigouvian. That's when we had our economist on, our Pigouvian tax.
That they cannabis is going to cost society something. Like we know that there's a deficit for alcohol of $6 billion. Well, actually, my calculations, the research I've done, cannabis actually puts $2 billion back into society. So it doesn't cost society anything from a perspective of a substance of misuse. There's very, very little cost to society. So this 15% tax you're talking about, more than likely they're saying this is to go to help, for all the substance misuse of cannabis, when it's not actually there. So, going back to your book, it's great that you're getting the research and attaching the research to it, because I'm really tired with governments making laws over stigmatization and ignorance.
Indeed. I mean, the perspective on the culture and persuasion aspect of transforming society, transforming the perspective on this, it seems to go very deep. It takes a lot to get somebody out of a mindset that is been with them for a long time, and it's supported largely still by institutions in society. I mean, you can't go to a hospital. You find a lot of people very anti-cannabis there, and it's a bit of a battleground for anybody who wants to consume cannabis to navigate hospitals. It continues to be culturally not recognized. It makes you wonder. I mean, we do have alcohol and tobacco, and those have been put up on the pedestal. These are the ones you can take. None of the other ones, which include psychedelics and other substances, which, they are more, I can tell you from my experience, they're a lot more fun, and they offer a lot more insight, more reflective. Alcohol for me was very dulling, got me in a lot of trouble. I don't know why that would be the substance our society would choose to champion as a culture. To me, it seems we're involved in a historical process, and it's very political, and that we have a lot of work to do in order to transform the way society approaches their free time, maybe their medicine, and maybe their like intoxication experiences too. Cannabis can fill those voids with the least amount of harm. It's the safer option. I always like that from when Colorado was legalizing this. They'd always say the safer than alcohol, because yeah, there may still be issues with it that we should talk about and protect ourselves from, be responsible adults about. But really, this is a smart choice, and it's taking a really long time to do it. I mean, these are all hurdles, but I think my book and our work really accentuates this point. Like, how is it that we keep this thing illegal from adults to consume, and yet there's children and the elderly who without this wouldn't be able to function? It feels like there's a real cognitive dissonance in society, where we have some people on one side and other people on the other, and we need to bridge that. I think podcasts and books and things like this are important for that reason.
Yeah, no, and of course we're all sitting here with like minds. I mean, how many times I've gone to music festivals and people are wandering around with their alcohol being complete jerks and disruptive, and we celebrate it. And we give away gifts to children. They can have a little fanny pack that says Palm Beach or Palm Bay on it, but yet we're not allowed to give a child a cannabis leaf because we're promoting cannabis. It's all backwards, and I don't get it either. And the longer Trevor and I have done this podcast, Trevor, the card carrying conservative guy that basically is now seeing cannabis more as medicine than I am. I'm starting to see some of the downsides of cannabis a little bit, but really, what's the harm in cannabis? Like, you're not going to get cardiovascular collapse, you're not going to get respiratory collapse, you're not going to find yourself face down in a mud puddle. It's not happening with cannabis, right? But tell me more about your book, man. So you started.
You got me thinking right now about another, like, kind of where I finished my book off, which is something which is in my face daily. The VCBC is right in downtown Victoria, 2 short blocks from the open air drug market of Victoria. We're surrounded by churches on both sides. And on the steps of the churches, for the last, I've been working with the group for about a year and a half there. There's been consistently new people on the steps of those churches, passed out with the long stem glass pipes you might have seen. People smoking fentanyl and other potent pain relievers, potent substances. There's an organization 2 blocks in the other direction called Solid, and they provide cannabis for free to people struggling with opiate addiction. This group is monitored by the University of Victoria, and they've been operating for a number of years, and they've had incredible benefit to those people who they help. We are in that intersection as well. Cannabis as a pain reliever, cannabis as a medicine, something which has less harms for people, all kinds of people out in the street for all kinds of reasons. And there's a whole lot of them that are really unwell, like really disabled. They're just physically unwell. They can't manage their lives because, like, helping a guy down the street to the food bank, his knee's all buckled. Like, why don't you help your knee? He's hungry, has nowhere to live. People in great distress down there. And cannabis is a safer option and should be available. If it was like we wanted it to be with legalization, it would be very inexpensive and available to those who really need it. The situation we have now is a continuation of prohibition, largely because of the capture of the market, that companies can keep prices high, and of course the illicit market competes and drives them down. But this is because people need it. It needs to be available, and these prices that they're trying to maintain really aren't sustainable. It feels like to me the goal always, I think Dana Larson was one of the better people at coining these things, but like, it's like tomatoes. Like we want it to be something which is on that level of accessibility in terms of price. Because as agricultural product, it could be grown at scale, especially when you talk about oils for medicine, topical products. It doesn't have to be glistening buds sending out. Just need to be harvesting the medicine from those and making them available. It's a bind, it feels like, in some ways.
It's a weed. It grows everywhere. Manitoba is soon to get our four. The NDP government has, I think it's supposed to happen this spring. They've actually, I think it's past third reading, and I think it's actually law now, but it has not been announced yet. So yeah. So we're going to get our four. I mean, even that is ridiculous, to get you four, because you may have four mothers, So that just shows ignorance. Sir, we've kept you. Is there, Trevor? Is there any questions you want to ask Owen? No. Owen, is there anything else about your book, about Elbows Up, about Buyers Club?
I'm hoping to have this book up for release by 420. So I'm going to work on it today. And the T-shirt I'm wearing can be found at the 420elbowsup.ca. I'll be putting up some more designs. Maybe some of these stickers will be sent out. But there's one more part. I guess we could mention. I mean, looking at the cover, you got the weed leaf, but around it you have a circle of mushrooms. So psychedelics have been part of my journey since I was a younger man, and I feel like they've helped me as well. Psychedelics right now seem to be following along the course that cannabis took, with a bit of a social movement in Vancouver. We have one in Victoria too, that's selling psychedelics in the similar formats to what we use, chocolate, gummies, this sort of thing, to make it a little bit more accessible.
I was in Haida Gwaii last summer. Was it already last summer? And going through British Columbia, and first thing I said to Trevor, there's mushrooms everywhere. It's like circa 2010 cannabis on the West Coast. I mean, magic mushrooms everywhere. And the other thing that this isn't a magic mushroom podcast, but magic mushrooms is actually less dangerous than cannabis.
Well, there's concerns with both. There's ways of managing them that are better. So I'm volunteering right now with MAPS, the Multidisciplinary Association of Psychedelic Studies.
Okay.
I use my graphic design wizardry to make presentations based on scientific studies and reports from scientists about the psychedelic therapy movement and the development of that. So if you go to MAPS social media pages, you'll start to see some of the presentations that I've been making, beautiful visual presentations that break down the data of some of these studies, talking about psychedelic therapy, cannabis, and this sort of thing, which is really great. I really love working with MAPS.
Thank you, sir. Thank you for your time. It's always a pleasure, and I will definitely drop into the Buyers Club next time I'm in Victoria.
Really great. Good to see you.
All right. So, what do you think of talking to Owen there? It was nice to catch up with him.
Like you said, when you're alluding to his future wiki page, seems to have his fingers in a whole lot of everything. Literally from the cannabis lawsuits, court cases that had a big deal with getting cannabis legal in Canada, all the way to the current where he's worried and interested in Canadian cannabis companies and things I didn't think of, like we'll pick on Tilray. Tilray been talked about being a Canadian company, but now really under U.S. ownership. So how, like everything else people are wondering about in Canada right now, how Canadian is that? If you have if your local McDonald's is owned by the U.S., but staffed by Canadians and using Canadian beef. How Canadian is it? I still don't have a good answer for that, but interesting that he's brought that into cannabis.
Yeah, I mean, as a rec market versus medical market, and it's still funny that cannabis sort of walks between that line, on the line of medical versus recreational. But I guess for the recreational users that are listening to our podcast, I guess what we're trying to do is encourage you to consider how you buy. So, I mean, I'm always one, buy local. Always try to find the closest cannabis that was grown as close to the retail store as possible, opposed to what we learned a couple of years ago, how cannabis can go across the country just to get packaged. I wonder if that's still happening. It's been a while since we've investigated the rec market.
I assume yes. Again, we're both sort of talking out of our ear on this one, but we do, and more importantly, I think if that is important to you, I think it would be very difficult for a consumer to know, because what we have found out through talking to one of our local, different craft cannabis people, but it sort of really came into focus with me when we're talking with Eric Green at Green Craft Cannabis, is, at the beginning, and I don't know if this has changed yet, I have to actually catch up with Eric at some point, but the beginning of what they were selling wasn't Green Craft Cannabis that would end up in the Dauphin store. They were selling cannabis in bulk to a bigger, we're picking on Afria. So let's say it was Afria. Afria buys a bundle of Green Craft Cannabis and then sells it to other people under some Afria brand. So it would be, I think, extraordinarily difficult for your average consumer, if they go into a rec store, to have any idea how far their cannabis traveled. But to a point you made earlier, as far as we know, the actual cannabis, I don't think can come from anywhere other than in Canada, legally in Canada right now.
Yeah, that's my understanding. Cannabis cannot cross borders. The paraphernalia does. But like Owen said, though, the issue becomes, are you buying from a Canadian company or not? And that's the thing. How do you ensure that your money is going to a Canadian company? And like he mentioned about CEOs getting big money. I mean, a couple of years ago, 5 years ago, cannabis companies were huge. I mean, they've lost some money on the stock market, but they were huge. And big companies with stocks, usually CEOs get the money, not the people down below. So try to keep the CEOs happy with the Canadian companies, buy Canadian. So.
Yeah, and another thing that he mentioned that I'm sure has come up, but I'd forgotten about was, and again, I as been mentioned, I'm a capitalist. I think people should make money, but is having, 4-ish large Canadian companies, did that help or hurt the consumer? Because, is it that keeping the prices artificially inflated? Owen said, like as if you compared them to tomatoes, should the cannabis be cheaper? Would it be cheaper if it was a bunch of little companies? And we didn't get into it with Owen, but, just worth mentioning, because anyone involved in Canada, well, we mentioned a little with Owen, is taxes. Like the amount of tax your average consumer pays on their cannabis is astronomical. And, and even whether you like or hate the cannabis companies, the cannabis companies' bottom line would be way better if they didn't have to pay, if you, the consumer, didn't have to pay so much in tax too. So, there was, as usual, when talking with Owen, there was a lot going on there.
Yeah, he's a very busy guy, and I've written about this in our blog page, essentially how the cost of cannabis to society is minimal compared to the cost of alcohol to society, yet we're still paying more taxes on cannabis with this assumption that it's a misused substance opposed to being medicine. And Owen Smith and Ted Smith, I mean, they're all about cannabis being medicine, right? It's not about cannabis being rec. I mean, he's talking about the area of town that they're situated in, I know the area very well. My sister-in-law lives very nearby to that area. I know the area. So there are lots of people who are houseless and who are, dealing with some issues with misuse of substances and cannabis. I mean, we've done episodes on this. Cannabis is a harm reduction agent. So if we could give people cannabis opposed to access to other more harmful drugs such as fentanyl, that society would be a better place. Now, of course, this is coming from advocates of cannabis. I'm sure other people, you're replacing one drug with another. However, the answer is yes. But from a harm reduction perspective, you try to drive a smaller car to save gas opposed to a big truck, So harm reduction to the environment, small cars use less, petroleum products. So cannabis is a harm reduction agent is so much better for society than fentanyl. So
and harm reduction, because it just came up in the hockey dressing room for I think the last skate of the year. This is not an ad for Zonix, but in Dauphin right now, a tiny little nicotine package is the most popular thing on earth. I can't believe how many people buy this to help them reduce smoking, and I kind of forget how many people around here use chewing tobacco. So to reduce chew and reduce smoking, they buy these little nicotine packages that you stuff in your lip, and extraordinarily popular. But of course, it came up in the dressing room was, is this less harmful than chewing tobacco? Is this less harmful than smoking cigarettes? And the answer is yes, absolutely. Now, same thing I said in the dressing room. Do I want a 15-year-old who has never smoked and never used chew to suddenly start shoving Zonic in their lip? Absolutely not. I'm not saying Zonic is harm-free, but it is a harm reduction from chewing tobacco or cigarettes. We can argue, lots of people can argue if cannabis is completely harm-free, but it's certainly less harmful than super strong opioids like fentanyl. So and we've had whole episodes, so not to rehash the whole thing, but harm reduction, cannabis just kind of makes sense.
Well, we haven't talked about Janesta Wilson King, and that episode's coming up, but as we were talking, she made a bold statement about, we're talking about harm reduction, and we're talking about cannabis and pregnancy, and that episode will be coming up. But she made the comment about cannabis is probably the safest drug she knows. When it comes to harm reduction and medicine, cannabis is a hugely safer drug than other over-the-counters. And we've talked about this before. Tylenol, very hard on your liver. Ibuprofen, very hard on your kidneys. Not even designed to be taken more than 2 weeks at a time. And people pop these pills all the time. Whereas cannabis, smoking, maybe the hydrocarbons is bad for your lungs, but the cannabinoids, and it's sort of like, you've heard me talk about people using the word overdosing on cannabis, or, they're tripping out on cannabis, they've overdosed. Well, you don't overdose unless you're going to die. So it's, it's a green out. So cannabis you can't overdose on cannabis. You can overdose on Tylenol, you can overdose on ibuprofen, but you can't overdose on Tylenol. On cannabis, but that's a different thing. So Owen Smith, lovely to catch up with him. He's a very active guy on LinkedIn. Anything else?
Nope, that was great. Thanks, Owen. We really appreciated the chat. Looking forward to the book and the things you'll be doing down the road with 420elbowsup.ca. So that was great and learned a lot.
I'm Kirk Nyquist. I'm the registered nurse, and we are Reefer Medness, the podcast found at reefermed.ca.
I'm Trevor Schufeld. I'm the pharmacist. This was another good chat, and some time down the road, maybe eventually we'll introduce ourselves at the beginning, but at this point, probably not.
Check out the complete library of Reefer Medness episodes at reefermed.ca. And make sure to follow us on all the socials for bonus info on what Trevor and Kirk are up to.
Well, we haven't talked about Janesta.
You're on mute.
Oh, sorry. Yeah.
Still on mute.
Technology, eh?